Dermatitis. Eczema. PAGE18. Dermatitis. Dermatitis is a general term that describes a common skin irritation. It has many causes and forms and usually involves itchy, dry skin or a rash. Or it might cause the skin to blister, ooze, crust, or flake off. Three common types of this condition are atopic dermatitis, seborrheic dermatitis, and contact dermatitis. Common types: 1. Contact dermatitis. 2. Atopic dermatitis. Contact dermatitis. Inflammation of the skin caused by contact with substances resulting in rashes, dry skin, and itching. Many substances can cause this reaction, such as cosmetics, fragrances, jewelry, and plants. Clinical features. Skin rash appears within a few minutes to hours of exposure to irritants. The symptoms include extreme itching, redness, blisters, swelling. Dry skin. Diagnosis. Physical examination, examination of the rash's pattern and intensity. Patch test, different potential allergens are applied to adhesive patches which are placed on the skin for 2 to 3 days and observed for any allergic reactions. Treatment. Topical steroids, reduces inflammation. For example, hydrocortisone. Clobetasol antihistamine, to reduce allergic response. And to reduce irritation, for example, cetirizine desensitization, to inject gradually the allergy-causing substance in low doses and thereby reducing the allergic tendency. Cold compress reduces swelling and to avoid itching. Foods to eat: well-cooked vegetables. Foods to avoid: foods that may cause eczema flares such as peanuts, milk, soy, wheat, fish, and eggs. Skin care. Encourage the patient to bathe in warm water using a mild soap, then air dry the skin and gently pat to dry. Topical application. Usual application of topical steroid creams and ointments is twice a day, spread thinly and sparingly. Phototherapy preparation. Prepare the patient for phototherapy because this method uses ultraviolet A or B light waves to promote healing of the skin. Acknowledge patient's feelings. Allow patient to verbalize feelings regarding their skin condition. Proper hygiene. Encourage the patient to keep the skin clean, dry, and well lubricated to reduce skin trauma and risk for infection. Avoid the irritant. Avoid allowing the reaction-causing substance to touch the skin. Anti-itch creams. Apply anti-itch creams or calamine lotion to the affected area. Cold application. Moisten soft cloths and hold them against the rash to soothe the skin for 15 to 30 minutes. Avoid fragrance-containing substances. Choose soaps, powders, and other personal products that are fragrance-free, as it could irritate the affected area. Atopic dermatitis. Atopic dermatitis, often referred to as eczema, is a chronic disease that causes inflammation, redness, and irritation of the skin. It is a common condition that usually begins in childhood. However, anyone can get the disease at any age. Atopic dermatitis is not contagious, so it cannot be spread from person to person. PAGE28. Dermatitis. Eczema. PAGE38. Risk factors: 1. Age 2. Allergies and asthma 3. Occupation 4. Health condition. Causes: 1. Immune system 2. Environment 3. Genetic 4. Exposure 5. Stress predisposing factors: 1. Family history of eczema 2. Having any allergies 3. Having hay fever 4. Having asthma. Dermatitis. Eczema. PAGE48. A. Itchiness. B. Dry skin. C. Rash on swollen skin that varies in color depending on the skin color. D. Blisters, perhaps with oozing and crusting. E. flaking skin F, thickened skin G, bumps and hair follicles. Common sites: childhood. During childhood, usually 2 years of age to puberty, it is most common for a red thickened rash, which may ooze or bleed when scratched, to appear on the elbows and knees, usually in the bend. Neck. Ankles. During the teenage and adult years, it is most common for a red to dark brown scaly rash, which may bleed and crust when scratched, to appear on the hands. Neck. Elbows and knees, usually in the bend. Skin around the eyes. Ankles and feet. Common triggers: rough wool fabric, dry skin infection, heat and sweat, stress, cleaning products, dust mites and pet dander, mold, pollen, smoke from tobacco, cold and dry air, fragrances, other irritating chemicals.